How are you doing today?
I'm doing okay.
All right, so I came in to take a general health history just before we take all your vitals and everything. So we're going to start with, what's your name?
My name's Shelby Harris.
All right. What is your social security number?
It's 1, 2, 3, 4, 5, 6, 7, 8, 9,
Cool. Date of birth?
8, 29, 99.
All right. What's your height?
It's 5'2",
5'2". Are you male or female sex?
female.
Female. Okay. Marital status? Single, married, divorced?
Single.
Single. What is your highest level of education so far?
High school education.
Okay. And you have a job anywhere?
I work at a library.
Okay. So what's your position there?
I'm a library assistant.
Okay. And who's your employer?
The Johnson County Library.
Okay, awesome. So what is the reason for your visit today?
My wrist has been hurting a lot.
Could you kind of describe what you mean by that in detail?
When I push on it or when I pick things up, I get a pain in my wrist. It's kind of like a stabbing pain.
Stabbing pain? So just, can you kind of point to the general area?
It'd be like around
Or
here.
okay. All right, so we're going to go into past medical history.
Okay.
So have you had arthritis,
No.
cancer,
No.
depression?
Yes.
Yes. Diabetes,
No.
epilepsy, seizures, heart problems, heart surgery? Just stop me if there's something that you're...
Yeah.
High blood pressure?
No.
Psychiatric disease?
No.
Stroke? Thyroid? None of those, so just the depression.
Mm-hmm.
Do you have any previous surgeries that we should know about?
Just my tonsils and adenoids.
Could you tell me when those were taken out?
It was, I think, when I was 3, so probably 2003.
2003? Okay. Have you had any serious injuries before?
No.
No. All right, medications. Are you taking any type of medication right now?
I'm on birth control, and then I'm also taking Lexapro.
Lexapro? Do you know what the dosage is for those?
25 milligrams for Lexapro.
How many times a day?
I take it once a day.
Do you have any allergies? Like drug allergies are important.
I have an allergy to some form of anesthesia, but the doctors still don't know what it is.
Okay, we'll look into that. Anything else?
No, that's it.
Okay, do you drink any alcohol?
No.
Smoke?
No.
Consume caffeine?
Not really.
No, not really. Do you use any recreational drugs?
No.
Are you on a special diet?
No.
Okay. Have you previously received any type of mental health services? Like psychotherapy, psychiatric services, therapy?
Yes.
Yes. Who is your previous therapist or practitioner?
Dr. Bubbles.
Dr. Bubbles? Are you currently experiencing overwhelming sadness, grief, or depression?
Not overwhelming, just general.
General. Approximately how long have you been feeling this way?
I'd say for about 2 or 3 years.
2 or 3 years. Are you experiencing anxiety, panic attacks, phobias?
Anxiety.
Anxiety. When did you begin to experience this? At the same time?
I'd say about the same time, yeah.
Are you currently experiencing any kind of chronic pain?
No.
Are you currently in a romantic relationship?
No.
No. Okay. Any significant life changes, stressful events that have happened pretty recently?
I think just moving into my apartment.
Moving to your apartment?
Starting college again. That's about it.
So now we're going to go over your family history. This isn't going to be including your cousins or anything. This is just siblings, parents, grandparents. All right, so do you know any blood relative who's had asthma, aneurysms,
No.
brain tumor,
Mm-mm.
cancer, diabetes?
Mm-hmm.
Diabetes? Type 1 or type 2?
I'm type 1.
Type 1. Epilepsy, seizures, headaches, heart problems, high blood pressure, kidney disease,
No.
lung disease,
Mm-mm.
migraines, MS?
No.
Psychiatric disease, stroke, thyroid, MS. Okay. So, right. So we're gonna go over some more of your health history. Do you feel like you're in good general health?
Mm-hmm.
Any recent weight changes, loss of appetite, fatigue, fever, chills? No. Allergies. You said you had a drug allergy
Mm-hmm.
to some type of anesthesia. Any food allergies?
No.
Hay fever? No latex allergies? Okay. So now we're going to go over the health of your nose, mouth, and throat. So just general ones: difficulty swallowing, earaches, loss of hearing, loss of smell, loss of taste, painful chewing, ringing in ears. Any sinus infections?
No.
Sores in mouth?
Mm-mm.
Okay. Eyes. Blind spots?
No.
Blurred vision?
Mm-mm.
Double vision? I see you wear glasses. Are you nearsighted, farsighted?
Both.
Both. Okay. Glaucoma?
Mm-mm.
Any injury to your eyes? Pain?
No.
Okay. We're gonna go over your gastrointestinal health. You have any blood in the stool?
Mm-mm.
Increasing constipation? Nausea?
Mm-mm.
Painful bowel movements?
No.
Persistent diarrhea? Stomach or abdominal pain? Ulcers? Vomiting? Nothing like that. Blood in your urine?
Mm-mm.
So you said you are a female. Do you have any irregular periods?
No.
No. No pregnancies or miscarriages? Vaginal discharge? Kidney stones?
Mm-mm.
Okay. Do you have any painful or burning urination?
No.
Sexual difficulty, STDs?
Nope.
Urgency with urination?
Nope.
Urine retention and incontinence? Nope. Let's go over your heart and lungs. Pain in your chest?
No.
You said no high blood pressure. High cholesterol?
Mm-mm.
Irregular heartbeat?
Nope.
Muscles. Let's go over your muscles, joints, and stuff. Back pain?
Nope.
Difficulty walking? Joint pain, swelling, stiffness?
A little bit of joint pain, I'd say, in my wrist.
In your wrist? Okay. Muscle pain or tenderness?
No.
Neck pain?
Mm-mm.
Neurological. Do you have any trouble with your balance?
No.
Blackouts, loss of consciousness, difficulty speaking, difficulty walking, facial drooping, headaches, injury to the brain or the spine, any concussions ever? Lightheadedness, dizziness, memory loss, mental confusion, migraines, mini stroke,
Mm-mm.
neuropathy, numbness or tingling, paralysis, stroke, tremors, weakness. Glad to hear that. Psychiatric. So you said you have depression and anxiety. Any eating disorders?
No.
Okay. Asthma,
No.
blood in your cough, cancer, chronic cough, frequent cough, emphysema. You ever had pneumonia before?
No.
No. Shortness of breath.
Mm-mm.
For your skin, rashes, itching, sun sensitivity, hair loss, color changes. Okay. And how is your sleep? Do you snore?
No.
Do you sleepwalk?
No.
Nightmares?
Yes.
You have nightmares? So do you feel like you sleep well?
No.
Not really. Do you feel rested when you're awake?
No.
No. Do you fall asleep during the day?
Yes.
All right, so that's all the stuff we're going to go over right now. We'll have a more detailed history later, and then we'll move on to your vital signs.
Okay, thank you.
Hi, Shelby. How are you doing today?
I'm doing okay. How are you?
Good. I was just coming. So as we enter the room, we begin our general inspection. We're mainly looking for airway, breathing, circulation, disability, and extrinsic factors. So what do we mean by that? We check gender and race, age, signs of distress, body type, posture, gait, body movements, hygiene and grooming, dress, body odor, affect and mood, speech, and signs of abuse. So when I entered, I checked if there was any deviation from her stated age. She appears to be the age that she says she is, doesn't look older or younger. Her race, her hygiene, she appears well groomed and clean. Her clothes are appropriate for the season, which is summer. And her gender, facial symmetry is normal. There's no drooping on one side of the face or other. Then we check her mental status. Was she easily awakened? Her response. She seems very aware of what is going on. After this, I will assess her orientation of person, place, time, and situation. All right, so I'm just going to have to verify your name and date of birth.
Shelby Harris, August 29th, 1999.
Do you know what the date is today?
September 12th, 2019.
All right, and do you know where you are?
The hospital.
What city?
Bloomington.
All right, awesome. Next, I'll check the patient's mood and behavior. Are they calm, agitated, anxious, compliant? In this case, my patient seems to be calm, in a good mood, and compliant. Next, I'll be asking my patient about her pain, how she rates it, the quality, location, precipitating factors, and when it started. So, how's your pain today?
I would say it's at like a 6.
6. Where is it located?
In my wrist, like right here.
Could you describe like what the pain feels like?
Whenever I push it down on something, I get a pain right across there. It's like a sharp
there?
pain. Yeah.
Okay. So it's just pushing down on things, is picking up things, make it any worse?
Yeah, picking up if it's like a heavier object.
Does it like radiate to any other locations?
No, it's mainly just in my wrist. I can
Alright.
feel it.
Awesome, thank you, Shelby.
The last part of my general inspection includes monitoring speech, whether it's cleared, delayed, stuttered, slurred, or mumbled. In this case, the patient seems to be talking very clearly and articulating words correctly. Then I'll check for mobility, any tics or tremors, use of devices, and range of motion. The patient seems to be in a healthy state of mobility and doesn't appear to need help walking. The only trouble with range of motion is her injured wrist. Next, I'll check body type, if she's thin, overweight, or weight appropriate for height. In this case, the patient is weight appropriate for her height, so nothing to be concerned about. Lastly, I'll make room observations, especially room safety. If there's any IV fluids, the bedside table, call light, rails, and the bed lowered. Just making sure everything's in the correct place.
Hi, I'm Lindsay. I'm going to be your nurse today. How are you doing today?
Diabetes.
Good. How are you?
Good. Can you tell me your name and date of birth?
My name is John Doe. I was born on October 28th, 1996.
Okay, let me check that. Your chart for patient orders, primary complaint, and patient history. Okay, I'm going to write my name up on the board and then today's date, so you know what day it is. Okay, and I'm going to go ahead and wash my hands again before we take vital signs. The first one I'm going to be taking is your temperature, so I'm going to go ahead and grab this. Alright, so I'll be putting this in your mouth, and when I insert it, you're going to want to close your mouth really tightly around it.
Okay.
I'm going to put
Today
the probe
I'll
cover on
be
until I
taking
hear
your
a click.
temperature. I'm going to put a probe cover
Okay.
on.
I'm going to put it in your
Just
posterior
open your
sublingual
mouth for
pocket.
me. I'm going to place it under the tongue.
I can't get it on for some reason. I want to redo that part.
Okay, and then I'm dispose of the probe cover.
Sure,
Okay.
orally. I'm going to just
Alrighty, I'm going to put that back, and then I'm going to perform hand
I'm going
hygiene
to place it under it.
to take your pulse. So this will take about a minute. And I'm going to be putting my fingers on, my two fingers on your wrist.
Okay.
So check pulse.
Okay, so I put the probe cover. I'll just tell you. Okay. Actually, I'll just like get this one right
Alright, so
now.
I got your pulse to be about 74, and your respirations are 14, both for a completely normal rhythm or a normal range and everything, so we're doing great. I'm going to perform hand hygiene before moving on. We're going to take your O2 saturation, so what that'll involve will be, I'll put this little thing on your index finger, and it's going to tell me your pulse and
Next, I will just be taking
your
your
O2
pulse. This
saturation.
will only take about a minute. And if you could just place your wrist for me comfortably. That also
Place your arm to the side.
So your pulse was 79 and your O2 saturation was 98. Alright, so the last one I'm going to be taking is your blood pressure. So it'll be two steps. So the first one I'm just going to be feeling for your pulse while I inflate the cuff just to get the baseline systolic reading.
Okay, perfect. Your pulse was 74. That's normal. The range is 60 to 100. Next, I will be taking this respiration. There's like sticky stuff like on my hands.
Yeah, I'm freaking out because I keep on messing up. Literally, just like when you're doing it in there, just take your time. Like, just be like, and even if you do say you're gonna take my respirations, you're gonna be able to see my respirations. So it's
Alright, it stopped around 117, which is normal.
I'm just gonna start
We're going to
from
wait
this
about 30
again,
seconds
so I don't have to
and
read
let
it.
your arm kind of relax. Now that we've
Can I
waited
also
30
take the
seconds,
rest?
I'm going to actually take your blood pressure.
That's it up. Oh my gosh. Okay, I'll just start from here again.
Is this comfortable for you?
Yes.
Okay, so your pulse rate is 74, which is normal. And I also took your rest. Why do I keep on forgetting? Oh my god, respiratory. I also counted your respirations. That's what I'm gonna say. Okay.
Alrighty, I got
119 over 68. Completely normal. Great blood pressure. Cuff out. Okay. Now, before I
Your
leave,
pulse is
I'm gonna go ahead
74,
and make
which
sure
is
your
normal, and I
car
also
is next
assess
to
your
you. The red button
Oh
will
my
be
God.
for if you need a nurse,
respiration
and the
rate.
rest
Why
of the
do I
buttons
keep
are for
on
your
like
remote.
us just stopping
Make
right
sure
there?
both your
I
bed
think I'm
rails are
getting
up.
nervous, Allie.
Your bed is in the lowest position.
No, I'm just getting nervous. I'm so sorry. Do you want to
like you have all your
do
personal
yours?
life close to you? Yes. Alrighty, is there anything you need before I leave?
No, thank you.
Alright, thank you. After I leave, I'll document my findings.